Well, good morning. My name's Paul Miller. I'm MPP for Hamilton East Stony Creek. And today I'm presenting Bill 185, a private member's bill. And it's an act to amend the Ministry of Community and Social Services Act to establish the Social Assistance Research Commission. And today I'm joined with a distinguished panel, and the panel consists of Craig Foye to my right. Craig is a staff lawyer with the Hamilton Community Legal Clinic. Anita Khanna is the National Coordinator for Campaign 2000, and Laura Cattari is a writer and community advocate from Hamilton. And I'll just start off with a brief description of, and I'll turn it over to Craig. This bill is about fairness for Ontarians, and in the direst of need, many of whom are unable to work, and many of whom are struggling to support children and loved ones. People on Ontario Works and ODSP have among the lowest incomes in this province, yet the decision on their incomes is not based on evidence. They are arbitrarily set by political choices, without process, behind closed doors. Social policy making in Ontario should be based on evidence and research. The gross inadequacy of social assistance is one of the main contributors to persistent child poverty, food insecurity, and unequal health and educational outcomes for Ontarians. An independent evidence-based commission to recommend social assistance rates will provide the government and the public with the information it needs to debate social evidence and assistance policies and set adequate social assistance rates in Ontario in their communities. The panel will have representation from people with direct lived experience on OW, ODSP, and other experts in the field. More than 900,000 people in Ontario rely on Ontario Works and Ontario Disability Support Programs. This has to change. The people of Ontario need help. And now I'll pass it on to Craig.
Thank you very much, Paul. I want to thank Paul Miller and his staff for proposing this vital legislation to introduce the Social Assistance Research Commission, which would be an expert panel to recommend evidence-based social assistance rates in an arm's length way on an annual basis. It should be noted that this is not a new idea. A similar bill was introduced by the Honourable Ted McMeekin, Minister of Housing, back in 2006. But this new bill improves on the original bill and I think starts to take us where we need to go. Many people don't know, as Paul mentioned, that current social assistance rates are arbitrary and politically determined numbers that have no actual relation to the actual cost of rent and food and other basic necessities in communities across Ontario. As a result, as many of you will know, the rates are shockingly inadequate. For example, the shelter allowance for a single parent with one child in Hamilton, where I'm from, falls approximately $400 below what the average rent for a two-bedroom apartment costs in Hamilton, meaning that that family is falling hundreds of dollars behind in their rent every month. The situation, as you might imagine, is even worse in Toronto. Individuals and families in receipt of provincial social assistance programs are suffering. The rates for regular social assistance were cut in 1995 by a previous government by 22%, almost overnight. Since that time, even under the current government, those rates have lost pace with inflation. Families are evicted repeatedly, and this is something we see in the community legal clinic where I work. Families are evicted repeatedly, meaning that their children have to change schools a number of times throughout their educational career. People who are trying to live on below subsistence level incomes are getting sicker and sicker every year that they try to live on those incomes. And we see that with people coming into our office. Individuals, and the hunger in our community is unprecedented. Individuals and families are turning to food banks in unprecedented numbers. And we know that the vast majority, 75 to 80% in Hamilton, are actually in receipt of provincial social assistance programs and should be able to afford food. This is going to have dire consequences for the future of our communities in Ontario. It's going to have all kinds of implications for public health, for education, and for our economy, because this is one of the greatest economic investments that you can make, because every dollar spent on people below subsistence level incomes is going to be spent locally in their communities. The Hamilton Community Legal Clinic thanks Paul Miller for championing this bill, and we would urge all members of provincial parliament across this province to please support this vital legislation. Thank you very much.
Thanks, Craig. Anita, you're up.
Thank you, Paul. Thank you, Craig. Our Ontario Coalition, Campaign 2000, is a nonpartisan provincial coalition of over 70 organizations that has been tracking progress or lack thereof against child and family poverty since 1997. As of December 2015, a couple with 2 children receives $1,408 through OW. The maximum amount they receive for rent is $718 a month. For everything else, they get $468. Clearly, those rates and those amounts don't reflect the reality of the cost of living that Ontarians face every day. An evidence-based, non-punitive approach to setting social assistance rates with the goal of reducing the poverty experienced by people on social assistance is long overdue in this province. Despite an increasing amount of income coming to low-income families through the child benefit system, child and family poverty remains unacceptably high in our province. 1 in 5 children in Ontario live in poverty, while children in families that are racialized, Indigenous, immigrant, affected by disability, or led by a female lone parent are even more vulnerable to poverty. Currently, the very low incomes that people on social assistance live with keep families and children in poverty. Low rates that don't reflect the true cost of living do a disservice to families who are struggling to make ends meet. They reflect a failure of our social safety net to adequately respond to the cost of living. We need to move away from persistent stigmatization and punishment of people on social assistance right away. Toronto has the highest child poverty rate of any large city in Canada. 28% of children here, more than 1 in 4, live in poverty. The city is getting more and more expensive, with the average rent for a 3-bedroom apartment around $495. Even that estimate seems a bit low, given the market. Toronto Public Health pegs the monthly cost of nutritious food for a family of 4 just under $850 a month. That means that paying the rent and feeding the kids in Toronto costs at least $2,300. This is before other essential costs are added in, like home internet, the cost of transit and getting to work, a telephone, clothing, or other essentials. This also doesn't include the birthday parties or school trips that children so look forward to in our communities. Ontario must improve social assistance rates in order to give every child the chance to succeed. Children who live in poverty go hungry, and they don't concentrate as well in school as their peers. Many internalize the shame and the social stigma of being poor. They live in unsafe housing, and they end up with preventable chronic diseases like asthma or diabetes. Even a short time in poverty through one's lifetime compromises their learning and their future employment outcomes. We can't delay in acting on this. Ontario has made some progress in the battle against child poverty through policies like the Ontario Child Benefit and other important moves, but progress has stalled. We would see support for this bill from all parties in the province as a step forward in Ontario's fight against child poverty for those living in some of the lowest incomes in the country. Ontario Campaign 2000 urges all parties to support this bill to move toward positive reform of social assistance immediately. We can and we must do better for all children in our province.
Thank you, Anita. And Laura.
Hello, my name is Laura Cattari. You may know me from Hamilton Roundtable for Poverty Reduction. I'm chair of the Social Assistance Reform Work Group there. And most importantly today, I speak from lived experience on the social assistance system, namely Ontario Disability Supports Program. I've been on the program for 12 years, and I can say with all honesty and sincerity that every year is becoming more and more difficult to put food in my refrigerator. The lack of fresh vegetables and fruit has affected my health in pre-diabetes, and the inability to afford meat has worsened my own condition. I ask you, I urge you sincerely, all members of the House, to consider supporting this motion, to look at evidence-based rates, how much it costs for me to obtain shelter and food, and because this is a chronic, lifelong illness, the cost of clothing and hygiene products, and possibly even a telephone and basic internet, so I'm not isolated in the winter months when it's difficult for me to leave home. These things are basic needs, and by basic needs, I mean dignity. I shouldn't be forced to live in shame, to hide and not socialize because I can't afford shampoo one week, or perhaps the cost of a cup of coffee so I can see friends. We're not asking anyone to go out of the way and to live the high life. I don't look for vacations or to afford a car or any of the things that people look to save and acquire. I just want to be able to be treated like a human being. Evidence-based rates are something we've worked for years, and I know the present government has committed to social assistance reform. For me, the first step is to know what that amount should be per region in this province. If you don't know the rate that you're working towards, then you can't change the system. Thank you.
Thank you, Laura. In closing, I'd like to say that this bill, which will receive second reading tomorrow, establishes a Social Assistance Research Commission tasked with recommending evidence-based social assistance rates to the provincial government on an annual basis. Those recommendations would be based on analysis of the actual costs of rent, food, and other basic necessities across this province. And the Commission would be required to set different social rates for different regions based on analysis of cost in those regions. I'd also like to say that, you know, the general public watches the proceedings in the legislature and some of the things that go on. They call it scandals, and you know, hundreds and millions, billions of dollars are wasted in this building every year. You've got to ask yourself a question. Where would the money be best spent? On Bay Street, or in our neighborhoods, in our cities, in our villages, in the north, in Aboriginal communities, where people are, you know, dying, committing suicide. They don't have a future. They don't have proper schooling. They don't have proper nutrition. They don't have much of a positive outlook on life. To me, governments are here to serve the people. To me, government should work from the bottom up as opposed from the top down. And I think it's time in Ontario, one of the wealthiest provinces, probably in one of the wealthiest countries in the world, that we start taking care of our own. It's time to move on and move up so we can help the people in our province that most need it. Thank you.